Ellen Simmons for the Rural Radio Network. Well, March is Colorectal Cancer Awareness Month, and the Nebraska Cancer Coalition is working to encourage Nebraskans to prioritize their health and get screened for colorectal cancer. We're joined today by Dr. Alan Thorson, a retired colorectal cancer surgeon and ex officio board member of the Nebraska Cancer Coalition. Now, just to put things into perspective, colorectal cancer is the second leading cancer killer in Nebraska, and only 64% of Nebraskans are up to date on their colorectal cancer screening. So, doctor, from a healthcare provider's perspective, what are some of the obstacles preventing Nebraskans from receiving recommended colorectal cancer screenings?
Well, first of all, Alan, thanks so much for giving us the opportunity to share this message. I think it's very important.
Absolutely.
As you said, a relatively small number of people are taking advantage of the opportunity to screen for colorectal cancer at this point in time. So we'd really like to up those numbers. It's important because we know that getting screened can allow us to actually, in most cases, to prevent colorectal cancer. So it's really a big deal, but it does take a number of steps to actually complete a screening exam in some instances. Uh, because of that, sometimes people find it difficult to actually get the screening done. And you asked about barriers. Number one, I think for some of our patients, it's a matter of distance, how far they have to go to get an examination. Depending upon what the examination is, and we'll get to that a little bit later, I think. But distance to get the exam done can be done. Finding a provider to do it sometimes can be a little bit difficult, particularly for rural Nebraska, our ranchers who, some of it, like Cherry County. I think about how many more cattle there are than people in Cherry County, and how far distances are. A lot of times, those of us in the eastern part of the state don't recognize that or don't remember that. So I've had the fortune to travel across the state several times through the Nebraska Passport program, so I've seen all those areas. It's beautiful, beautiful. But some of that beauty can create some obstacles for some of our patients. The other thing is sometimes there's can be embarrassment about the test. You're talking about the colon, the rectum. Sometimes that makes people uncomfortable for a certain number of the population. It takes time. Again, depending upon the test you select, and that's one of the things we'll cover is that do have options, which can have a significant impact on ability to get a test done, and I think probably can overcome some of the barriers that we're talking about right now. So time is one of the issues, and cost. Cost can be somewhat of a problem for those who aren't insured, don't have any other access. Again, we can solve a bunch of those problems, so cost problems also by the type of test that we select. So those I think are probably the big things in time, distance, cost, embarrassment, and then actually the last thing is knowing about the availability. So we're covering that one here right now, I hope, today.
Absolutely. Well, what are some other recommended screening options available to Nebraskans for colorectal cancer screening?
Great question. I alluded that we're getting to that, so here we are. We kind of split from the medical standpoint, from the physician standpoint. We kind of split the options into two basic broad categories. One is we have tests that can actually potentially prevent colorectal cancer, and then we have those that are best at detecting colorectal cancer early when it's very treatable and very curable. We know, for instance, that if we can prevent cancers by removing polyps, which are precancers. It's like having a mole on your skin that might change into a melanoma or a cancer. You take the mole off and you prevent it. Same kind of principle here. We have a polyp in the colon. Not all polyps are precancerous, but some are. You can get them removed and prevent a cancer. We know that that's probably the best thing to do is prevent a cancer. Who wants one? If you do, though, then it's best to diagnose it as early as possible. We know that colorectal cancer, if it's diagnosed at the first stage, stage 1, the cure rate can be as high as 95% or better. If it's stage 4, the cure rate is going to be like 5 or 10%. So timing there is critical, and to understand that. So back to the two areas of testing: prevention, early detection. Let's go with prevention first. That's a colonoscopy. It's kind of considered the so-called gold standard because it does allow for prevention if you have a colonoscopy for screening purposes. And let me step back just 1 second, if we could. When I talk about screening, that means having the test done because you've reached a certain risk category. And typically that risk category is defined by age. So it's not because you have symptoms. It's not, you don't get screened because you had some bleeding, or you don't get screened because you had diarrhea or a change in bowel habits. You get screened because everything's going just fine, which, by the way, that's kind of a barrier because people think, I'm fine. Why do I need to do anything? But that's when you do need to get screened. So backing up again then, so when you have a screening examination with a colonoscopy, you can get that potentially find a polyp and have a polyp removed, which could prevent a colon cancer down the road. The issue with that option, and I'll just go through some of the pluses and minuses of each test if we have time. The advantage of the colonoscopy is that it is preventative. You can potentially find a polyp and remove it. The downside is all those things we talked about. Cost, it's one of the more costly exams if you don't have insurance. Distance, so if you do live a little far away from a center that does colonoscopy, it takes time to drive there. The preparation, I didn't mention preparation as a barrier, but for colonoscopy it can be, because for colonoscopy you need to completely clean the colon out. That takes time. It takes some expense to purchase the prep. Depending on the prep you use, it's highly variable. It's not a great amount, but it can have an impact. So the prep is a downside, the distance to travel, the cost. The big plus is the preventative nature. Now we go to those that are more early detectors. So that's the stool tests. So the stool tests, there's several. So there's the DNA. So Cologuard, maybe people have heard that term. Cologuard, it's a test, combines fit with DNA testing of the stool. Let me back up. I'm sorry, I'm jumping around, but another advantage of the colonoscopy, if you're normal, you only have to do it once every 10 years. So we get to the Cologuard. It's recommended to do it every 2 to 3 years, probably every 3 years. So it has to be done more often, but you can do it at home. There's no prep. If you select a Cologuard, they send you a kit. It's given very good instructions on how to do that. You have to place a stool sample, the whole sample, into a bucket, so to speak, or a container, we'll call it, and then mail that in, and you get the results. And Cologuard is good at detecting early cancers. It's quite good at detecting polyps, but of course it doesn't remove them, it finds them. So anybody undergoing Cologuard or any of the stool-based tests, you have to go into that understanding that if it comes back positive, your screening isn't complete until you have a colonoscopy to find out why that test was positive. So there's Cologuard. Then you have the stool blood test. The two primary ones you're interested in is FIT test or FOBT. FIT's become more popular, I think, because it's a little bit more accurate. But again, there's no prep. It can be done at home. It doesn't have to have a total stool sample. So it's easier for a lot of people to undertake that examination. But then you come into the realization that it has to be done every year. You don't do a FOBT or a FIT test every year, it loses its effectiveness and you start increasing your risk of developing cancer. So, 10 years, 3 years, every year. Okay, those are kind of the options there. But it saves a lot of time, saves prep time, it saves distance traveling time, it saves cost. A cost of a stool test is probably going to be 10 to 20 bucks. Okay, a DNA test is going to be several $100s. A stool DNA, a colonoscopy, it could be $1,500 to $3,000. So, and those are just round numbers, depending upon the facility you go to and the physician. It's highly variable. But the point there being, the stool tests are really the cheapest. And as you increase this accuracy and going from early detection to prevention, it becomes a bit more expensive. The final test we do have now is a blood test. And some people have been hearing about this, others are not aware of it yet. Uh, it's very simple. If you don't mind a needle stick, okay, you can get blood drawn. It's not nearly as accurate. It's not very good at detecting. It's actually rarely detects a polyp, I'd say. It can detect early rectal cancers, but it's really its best at finding a more advanced cancer. So it's a downside of that. It's not preventative. It's only fair at early detection, and it's quite expensive. Um, maybe $600, $700, $800. So that test, if someone absolutely refuses to deal with stool at all, a blood test is an option. So you need to know that that's available, but it has quite a few downsides to it. I think those are the main options that we have. But they can tell it's a number of options. It's actually provides you, if someone's interested in getting screened, they have that opportunity to talk to their physician, or you can. A lot of the health, I think during the March campaign, there'll be some of the health departments will be able to offer free stool tests, FOBTs or FIT tests. So you can actually do it very economically and have a pretty good test. But remember, for the stool test, those stool tests, the blood tests, which is what FIT does, and FOBT, they look for blood in the stool. They have to be done every year. Otherwise, you lose the impact of your screening exam.
I think what's unique about this is that colorectal cancer screening gives you, and you've been saying this, gives you options. You have choices to decide if you want to be aggressive about it and find out, you know, prevent it while finding out if you do have cancer. You know what I'm saying? Like, you have options compared to other cancers where you only have one option of screening.
Yeah, and I should talk about options. One other thing I should bring up with the prep is a huge thing for colonoscopy, but there's also options for that. So if you, including pills, you can take pills for your prep. Okay, so that's an area of discussion a patient could also have with their physician about, okay, what kind of a prep do I have to take? Let's hear the options. I want to know what the options are, because there are quite a few. The worst stories are always, historically, people had to drink a big gallon jug. It's called Go Lightly. Why that had that name, people always joked about. But that's not used as much at all anymore, because we have a lot of options for having to drink a lot less fluids. And I said even tablets are available. So one thing people should always do is ask questions. Somebody says, you need to be screened. Okay, tell me what my options are. You need a prep. Tell me what my options are. I want to know. And I think that'll help them feel more comfortable with what they have to do, and hopefully get more people to say, yeah, maybe it's not so bad.
All right, very good. Well, thank you so much for joining us. I appreciate it.
Well, thank you. Thank you so much for the opportunity, Ellen. I really appreciate your helping us to reach out to all of Nebraska. Hopefully this message will be helpful to people as they search for ways to minimize their risk of cancers. Have a good
Absolutely.
day.
All right. Well, that's Dr. Alan Thorson. He's a retired colorectal cancer surgeon and ex officio board member of the Nebraska Cancer Coalition. If you'd like to learn more, you can go to nebraskacancer.org/colorectal cancer. I'm Ellen Simmons for the Rural Radio Network.